focused on male and female cancers, prostate, breast, ovarian, each with 4 answer choices and detailed explanations. /Oncology, Clinical Vignettes, Prostate, Breast, Ovarian Cancers. 1. Prostate cancer, risk factors. A 68-year-old man with a history of smoking and obesity presents with urinary hesitancy, nocturia, and back pain. A digital rectal exam, DRE, reveals an irregular, firm prostate. PSA is elevated. What is the most significant risk factor for his condition? A. Smoking. B. Family history. C. Benign prostatic hyperplasia. D. Alcohol consumption. Answer B. Family history. Explanation. Prostate cancer risk increases with age, family history, and African American ethnicity. Smoking and obesity contribute, but genetics is the strongest predictor. Breast cancer, BRCA mutations. A 40-year-old woman with a family history of breast and ovarian cancer has a palpable breast mass. A biopsy reveals an invasive ductal carcinoma. Which genetic mutation is most likely responsible? A. TP53, B. BRCA1, HER2, APC. Answer B. BRCA1. BRCA1 and BRCA2 mutations significantly increase the risk of breast and ovarian cancer. TP53 mutations are linked to Li-Fraumeni syndrome. 3. Ovarian cancer, tumor marker. A 55-year-old woman presents with abdominal bloating, early satiety, and pelvic discomfort. Ultrasound shows a complex ovarian mass. What tumor marker is most useful for monitoring her disease? A. CA125, B. AFP, CEA, D. Answer A. CA15. Explanation. CA125 is elevated in ovarian cancer, but it is not specific, also elevated in endometriosis and inflammation. It is useful for monitoring disease progression. HAS4, prostate cancer metastasis. A 72-year-old man with prostate cancer complains of severe back pain. Imaging reveals osteoblastic lesions in the lumbar spine. Which is the most likely route of metastasis? A. Hematogenous via the portal vein. B. Lymphatic spread to the lungs. C. Direct invasion of the bladder. D. Hematogenous spread via the vertebral venous plexus. Answer D. Hematogenous spread via the vertebral venous plexus. Explanation. Prostate cancer commonly metastasizes to bone, especially the spine, through the Batson venous plexus, leading to osteoblastic lesions. 5. Breast cancer, HER2-positive tumors. A 46-year-old woman is diagnosed with HER2-positive breast cancer. What is the best targeted therapy? A. Tamoxifen. B. Trastuzumab C. B. Vicizumab. D. Imatinib. Answer B. Trastuzumab. Explanation. HER2-positive breast cancers overexpress the 2 receptor. Trastuzumab Herceptin is a monoclonal antibody that blocks HER2, improving survival. 6. Ovarian cancer, epithelial versus germ cell tumors. A 23-year-old woman presents with rapidly growing abdominal mass and weight loss. Imaging shows a solid ovarian mass. AFP is elevated. What is the most likely tumor type? A. Serous cystadenocarcinoma. B. Mucinous cystadenoma. C. Dysgerminoma. D. Yolk sac tumor. Answer D. Yolk sac tumor. Explanation. Yolk sac tumors are germ cell tumors that produce AFP and occur in younger women. Epithelial ovarian cancers, e.g. serous tumors, are more common in older women. Breast cancer, hormone receptor status. A 50-year-old woman is diagnosed with a breast mass. Pathology reveals an ERPR-positive, HER2-negative tumor. What is the best initial treatment? A. Trastuzumab. B. Tamoxifen. C. Rituximab. D. Bevacizumab. Explanation. Tamoxifen is a selective estrogen receptor modulator used in ERPR-positive breast cancer to block estrogen-driven tumor growth. Ovarian cancer. Protective factors. A 35-year-old woman asks about ways to reduce her risk of ovarian cancer. Which of the following is protective? A. Early menarche. B. Late menopause. C. Oral contraceptives. D. Nulliparity. Answer. C. Oral contraceptives. Explanation. Oral contraceptives, multiparity, and breastfeeding reduce ovarian cancer risk by suppressing ovulation. Frequent ovulation increases the risk. 9. Prostate cancer. Gleason score. A 70-year-old man is diagnosed with prostate cancer. His biopsy Gleason score is 8K. What does this indicate? A. Low-grade tumor with slow progression. B. Intermediate risk of progression. C. High-grade tumor with poor prognosis. D. Benign prostatic hyperplasia. Answer C. High-grade tumor with poor prognosis. Explanation: the Gleason score 210 grades prostate cancer differentiation. High scores, 8, indicate poorly differentiated aggressive tumors. 10. Breast cancer, Paget's disease. A 58-year-old woman presents with persistent eczematous rash of the nipple and areola associated with bloody nipple discharge. What is the most likely underlying malignancy? A. Fibroadenoma. B. Invasive ductal carcinoma. C. Lobular carcinoma in situ. D. Inflammatory breast cancer. Answer: invasive ductal carcinoma. Explanation: Paget's disease of the breast presents with nipple eczema and ulceration, often due to underlying invasive ductal carcinoma. Key takeaways for male and female cancers. Prostate cancer risk: age, family history, African American race, BRCA1 and BRCA2 mutations, risk for breast and ovarian cancer. CA125, marker for ovarian cancer, useful for monitoring, not screening. Prostate cancer metastasizes via vertebral venous plexus, osteoblastic bone lesions. HER2 plus breast cancer, Trastuzumab, HER2 targeted therapy. Yolk sac tumor, elevated AFP, common in younger women. ERPR positive breast cancer, Tamoxifen or Aromatase inhibitors. OCPs and pregnancy, protective against ovarian cancer. High Gleason score 8. Aggressive prostate cancer. Paget's disease of the nipple, associated with invasive ductal carcinoma. Would you like a set on